Bismillahir Rahmanir Rahim. This is the second lecture of benign breast disease. Now I will talk about the types of benign breast disease. The seventh type of benign breast disease is gynecomastia of the breast. It is a common condition that causes boys and men's breasts to swell and become larger than normal. Gynecomastia of the breast is most common in teenage boys and older men. I will talk now about the treatment for gynecomastia of the breast. The first option is medication to adjust a hormone imbalance. The second option is surgery to remove the excess breast tissue. Male breast reduction is not usually available on the National Health Service for the treatment of gynecomastia. The eighth type of benign breast disease is intraductal papilloma of the breast. The small wart-like growth from inside the mammary duct near the nipple. This is the small wart-like near the nipple. Intraductal papilloma may cause nipple discharge. The condition most commonly affects women aged between 30 to 50 years. Your risk of cancer goes up if you have 5 or more papillomas at one time. Surgery can remove these growths and reduce your cancer risk. The ninth type of benign breast disease is mammary duct ectasia of the breast. Menopausal and postmenopausal women are more prone to mammary duct ectasia. You may experience an inverted nipple or nipple discharge when swollen. Inflamed milk ducts are blocked. Also known as periductal mastitis. This condition does not increase cancer risk. You may need antibiotics if a bacterial infection caused the inflammation and blocked. Otherwise, you don't need treatment. The 10th type of benign breast disease is traumatic fat necrosis of the breast. These breast lumps from when scar tissue replaces breast tissue that's been damaged by an injury or surgery or radiation therapy. Fat necrosis does not raise your cancer risk and don't need treatment. The 11th type of benign breast disease is Mondor's disease of the breast. It is a rare and benign disorder of the breast. It is characterized by thrombophlebitis of the superficial veins of the chest wall. Clinically, Mondor's disease of the breast manifests as a cord-like induration of the breast area. Treatment with anti-inflammatory drugs, for example, ibuprofen, and warm compresses are helpful, and lesion resolves completely within 2 to 8 weeks. The 12th type of benign breast disease is benign phyllodes tumors of the breast. There are rare breast tumors that start in the connective tissue of the breast or called stromal, not the ducts or glands, which is where most breast cancer start. Most phyllodes tumors are benign, and only a small number are malignant. Phyllodes tumors are most common in women in their 40 years old, but women of any age can have them. The 13th type of benign breast disease is lactating adenoma of the breast. It is an uncommon in pregnancy or lactation. Although it is a benign condition, it often requires core biopsy or even surgery to exclude malignancy. The 14th type of benign breast disease is myoepithelioma of the breast. It is a very rare tumor originating from the myoepithelial cells of normal duct lining of a breast. The two cell types, epithelial and myoepithelial, are found in the linings. The 15th type of benign breast disease is hematoma of the breast. A breast hematoma or fibroadenolipoma is a rare benign mass composed of well-encapsulated fatty, fibrous, and adenomatous elements. Hematoma of the breast often present as a prominent palpable mass or as gross breast asymmetry. They vary in size between 1 to 20 cm, with a mean size of 6 cm. The 16th type of benign breast disease is breast hemangioma. It is a very rare benign vascular neoplasm accounting for 0.4% of all breast tumors. Breast hemangioma is most commonly detected as an incidental microscopic finding in biopsy specimens obtained for unrelated reasons. The 17th type of benign breast disease is hemangiopericytoma of the breast, or HPC, is a rare vascular tumor originating from the capillary pericytes, which are contractile spindle cells surrounding the capillaries and postcapillary venulus. The 18th type of benign breast disease is lipoma of the breast. A lipoma in the breast is a benign tumor made up of fat cells. It is usually harmless and painless. If the lipoma is large, it could lead to symptoms including a lump under the skin that feels soft and doughy. If the lipoma presses on a nerve or blood vessels or joints, it could cause pain. The 19th type of benign breast disease is granular cell tumors of the breast, or GCT, is an uncommon neoplasm arising from perinuclear Schwann cells that can arise anywhere in the body and is particularly rare in the breast. Imaging typically shows an irregular, non-calcified mass with high density on mammography and intense posterior shadowing on ultrasound that mimics malignancy. The 20th type of benign breast disease is benign stromal spindle cell tumors of the breast. Is a benign breast lesion that histologically consists of adipocytes, collagen fibers, and uniform spindle cells. The cause of these lesions is unknown. Spindle cell lipoma usually presents as a painless mobile palpable mass. In the end of this lecture, thank you for all.